Yes, ma'am.
Hi, my name is Donna. I'm from Johnston.
Hey, Donna, how are you?
Fine. I have a couple of questions. Is this healthcare bill going to afford us free market competition? Secondly, if there's $38 trillion of fraud in Medicaid, what checks and balances are we going to have with this new healthcare? Who's going to write the bills? Who's going to implement them? And what pork is going to get added to them? And yes, I have health care, I have TRICARE, because my husband passed away. 24 years, a Navy commander. So, what's going to happen to my health care?
Well, first of all, I know that. First of all, let me thank you for your endorsement for your husband, because being a Navy wife for 24 years, you're serving home. Let me try to tackle the question. The first question, we are trying to ensure that there is free market competition by building these exchanges in which private plans can be offered to will be open. Second, we're trying to do all we can to maintain employer coverage in private insurance. So the whole point is to try to really build a market which is more efficient, more competitive, and people can make choices of what plan they want to go. The issue of the
checks and balances.
In what sense?
In the sense that we have so much fraud in Medicaid now. We have doctors who are giving tests out unnecessary because they're so afraid of being brought into a lawsuit. What checks and balances are we going to, what checks and balances are you, the government, going to let us know so that we feel comfortable enough to know that this isn't going to happen with a new system?
Right.
Because you have a broken system. What guarantees the new system isn't going to be broken down the road too?
First of all those things that you described are already illegal. We have provided additional enforcement tools to federal authorities. Already, before we finished our deliberations on this health care bill, the Department of Health and Human Services and the Department of Justice has formed a special Medicare anti-fraud task force. They are taking very strong legal action because there is laws in the books right now that are being violated. And we're going to have to not do this temporarily. We're going to have to maintain this focus on enforcing the laws as they exist today and giving the enforcers more authority, more tools to do the job.
Then that brings me to who's going to implement it.
The implementation,
Who's in charge of this?
yeah, the implementation of a significant part of the bill would be the Secretary of Health and Human Services, and she would have to promulgate regulations which would be subject to comment and also legal challenge if there's a legal challenge. But the primary implementer would be the Secretary of Health and Human Services.
That would be the
Yes. You have mentioned TRICARE.
Can we ask some questions?
I think TRICARE frankly, has been a very important component of our healthcare system, but I think it can be enhanced. And we have not made significant changes to the TRICARE program. As you know, it runs under it runs under the Department of Defense. But I think that's something that we have to do, particularly in the context of families that are not closely located to a military facility because they don't have the support structures there. And I think going forward, honestly, given the number of men and women who serve and have encountered stress and traumatic brain injuries, we're going to have a much more robust system. Not only Veterans Affairs, but also TRICARE.
About in the back here.
One other question.
Oh, my God.
I only have time for a few more, so I'll give have a chance. Let me ask somebody else.
Over here.
You're in red, gray hair.
Hey. This is the back.
Okay, and I work in Westfield. I'm a nurse.
want to beg you to proceed with everything that you can to enact healthcare reform in every family in America is affected by it and is harmed by the rising costs. Each day I work in the intensive care unit, I see the waste and the unnecessary things that are done to people, not for people, to them. Our care needs to be improved. There are standards of care, and I'd like you to just talk more about how that will help save costs, improve the health of all Americans. We're paying for it now, but we're not getting what we need. We are paying, my health insurance is raised 3 times more than my salary. And so I'm paying essentially a tax for health care, but I'm not getting what I should get because it costs twice as much as other people in the world do, and they get better outcomes and get better health. So for healthcare workers everywhere, for families everywhere, please continue to work on this, and if you can explain how the public option helps bring down costs and prevent waste. There's a lot of waste in the system.
Thank you. Let me thank you for your service as a nurse. Nurses are the backbone of our healthcare system, and they work long hours with great dedication, and you're obviously, as an intensive care nurse, very highly qualified and work in a very challenging environment. So you and air traffic controllers are very impressive people, and I appreciate that you are here. Let me give an example that comes out of intensive care units. It's a quick story. I promise I won't take too long. In Michigan, some years ago, a number of intensive care units banded together in an effort to try to reduce the level of complications in intensive care units. As you know better than I do, infections from lines that you have to insert into people's bodies to support them. They can get infections from catheters and have to go into their bodies to relieve them. They can get infections from not being moved around enough so that they have respiratory complications to develop. And they're all preventable if you really get the system down. And Michigan was that in 15 months, they saved approximately 1,500 lives while saving $150 million by eliminating all of those complications. The problem was, and then we did that in Rhode Island, so your Westerly Intensive Care Unit and others are all participating in the same program in Rhode Island. And when we started setting that up, I spoke to all the hospitals and I said to them, what's it going to cost you to do this? And they said, well, probably $400,000 a year for a intensive care unit. And we had discussions about this, so I knew what the number was. They said that the savings could be as much as $8 billion every year for intensive care units. So 20-to-1 payback, why not do that? And that was an education for me because the hospital administrators explained to me that it was their $400,000 that went out the door to pay for this. The $8 million that they saved was actually lost revenue to the hospital because the extra days were hidden. And so they had to find it someplace else if they lost it. But they said, Sheldon, we will do this because we know it's the right thing. It's proven itself in Michigan. It is a good thing for us to do. We'll do it because it's the right thing. But you have to understand, you're asking us in the business proposition to spend $400,000 a year to lose $8 billion in revenue. That is a tough business proposition. It helps explain why so many of the quality initiatives that actually save money for the system never get implemented. Because at the point of decision, the person who has the responsibility for doing it doesn't save the money, somebody else does. And that is a real defect in our present healthcare system. And a public option would help get around that, because the public option would have a less short-term, immediate gain perspective. It could say, you know what, 5 years out, 10 years out, if we can change this healthcare system in the right direction, we can save this money in the long run, and we can do it because it's the right thing, and it puts it on the list of officials. So that, I think, is how your work in intensive care unit relates to the public option. Let me call on one of the people from the medical school here. We've got a lady who's had her hand up for quite a long time. And then this gentleman in the blue t-shirt and the white stripe who's been energetically standing there with his hand up. We'll do you two. And then I'll do one last question because we really should let people go. And then I stick around after these. So if you haven't gotten your questions heard, obviously we have a limited amount of time and a great amount of interest in questions. So forgive me if we did not get to you specifically. I will stay here to hear your question or your story. Please go ahead.